Hi, and welcome to our video on anatomical terms. Anatomical terms are used to describe specific areas and movements of the body, as well as the relation of body parts to each other. It is essential for health professionals to have knowledge of anatomical terms in order to effectively communicate with colleagues in a scientific manner. Directional terms describe the positions of structures relative to other structures or locations in the body. For example, superior or cranial mean towards the head. For example, the hand is part of the superior extremity. Inferior or caudal, away from the head. For example, the foot is part of the inferior extremity. Anterior or ventral mean front. For example, the kneecap is located on the anterior side of the leg. Posterior or dorsal means back. For example, the shoulder blades are located on the posterior side of the body. Medial means toward the midline of the body. For example, the middle toe is located at the medial side of the foot. Lateral means away from the midline of the body. For example, the little toe is located at the lateral side of the foot. Proximal means toward or nearest the trunk or the point of origin of a part. For example, the proximal end of the femur joins with the pelvic bone. Distal means away or farthest from the trunk or the point of origin of a part. For example, the hand is located at the distal end of the forearm. The body can also be divided into planes. The coronal or frontal plane is a vertical plane running from side to side. It divides the body or any of its parts into anterior and posterior portions. The sagittal or lateral plane is a vertical plane running from front to back. It divides the body or any of its parts into right and left sides. The axial or transverse plane is a horizontal plane that divides the body or any of its parts into upper and lower portions. The median plane is a sagittal plane through the midline of the body, and it divides the body or any of its parts into right and left halves. Body cavities are spaces in the body that contain internal organs or viscera. The two largest human body cavities are the ventral cavity and the dorsal cavity. The ventral cavity is at the anterior or front of the trunk. It is subdivided into the thoracic cavity and the abdominal pelvic cavity. The dorsal cavity is at the posterior or back of the body and includes the head and the back of the trunk. The upper ventral, thoracic, or chest cavity contains the heart, lungs, trachea, esophagus, large blood vessels, and nerves. The thoracic cavity is bound laterally by the ribs and the diaphragm caudally. The thoracic cavity has two openings, one from the top, leading to the mouth and throat, and the other allowing the esophagus and other important vessels and tissues to pass between the thoracic cavity and the abdominal cavity. The thoracic cavity has several functions. The first is to provide protection and support the body's vital organs. The lower part of the ventral cavity or abdominopelvic cavity can be further divided into two portions, the abdominal portion and the pelvic portion. The abdominal cavity contains most of the gastrointestinal tract as well as the kidneys and adrenal glands. The abdominal cavity is bound cranially by the diaphragm, laterally by the body wall, and caudally by the pelvic cavity. The pelvic cavity contains most of the urogenital system as well as the rectum. The pelvic cavity is bounded cranially by the abdominal cavity, dorsally by the sacrum, and laterally by the pelvis. The smaller of the two main cavities is called the dorsal cavity. As its name implies, it contains organs lying more posterior in the body. The dorsal cavity, again, can be divided into two portions. The upper portion, or the cranial cavity, houses the brain, and the lower portion, or vertebral canal, houses the spinal cord. The cranial cavity, also known as intracranial space, is the space within the skull that accommodates the brain. The skull, minus the mandible, is called the cranium. The cavity is formed by 8 cranial bones, known as the neurocranium, that in humans includes the skull cap and forms the protective case around the brain. Let's discuss some cranial anatomical terms. Rostral or oral means towards the tip of the nose or the mouth from a more posterior point. Occipital or aboral means toward the occipital bone from a more anterior point. Nasal means towards the skull midline, and temporal means towards the temporal bone, or lateral from a more medial point. Let's discuss the anatomical terms of motion. Extension, motion, means movement increasing the angle between two body parts. Flexion is movement decreasing the angle between two body parts. Abduction is movement away from the midline. Adduction is movement towards the midline. External rotation is a rotation away from the midline, whereas internal rotation means rotation towards the midline. Elevation is movement in a superior direction. Depression means movement to an inferior direction. Anteversion is forward inclination of an entire organ, and retroversion is backward inclination of an entire organ. Finally, circumduction is circular motion of a limb. There are also some extremity-specific anatomical terms of motion. For example, dorsiflexion refers to the movement of the hands or fingers toward the dorsal side, or the movement of the toes or foot towards the chin. Palmar flexion refers to the movement of the hand or fingers toward the front of the forearm. Pronation refers to the rotation of the hands or forearm so that the palms are facing posteriorly. Supination means the rotation of hands or forearm so that the palms are facing anteriorly. Opposition is the movement and rotation of the thumb's tip towards that of any other finger. Reposition is the movement and rotation of the thumb's tip away from that of any other finger. Protraction is the forward movement of a part of the body. Retraction is the backward movement of a part of the body. Eversion is the movement of the sole of the foot in an outward way, away from the midline. In addition to the terms already discussed, there are some anatomical terms of motion related to the spine. For example, inclination is the bending of the head or torso forward. Reclination is the opposite, bending the head or torso backward. Lateral flexion is the bending of the head or torso sideward, and rotation means to rotate the head or torso on the longitudinal axis of the spine. The body also has two pelvic-specific movements. Nutation is the anterior tilting of the sacroiliac joint, and counternutation is the posterior tilting of the sacroiliac joint. Our mandible can undergo two specific motions: lateral excursion, which is the movement of the mandible away from the midline, and medial excursion, which is the movement of the mandible towards the midline. Thank you for listening to our presentation